be the obturator nerve. I don't know. Every year I change my mind. Every year I call this the obturator nerve, then I cross it out and call it genitofemoral. So we'll keep it at genitofemoral, but that's femoral. The stupid thing is that this comes on, this nerve right here should not come off this low. See how it comes off low? It should actually be up a little further. This is why I don't like this femoral nerve, because this is just down too far away. The lumbar plexus basically is right here, and the femoral nerve is one of the biggest nerves coming off that plexus. This, when I look at this here, this is the sacral plexus. And the big nerve that the sacral plexus is the sciatic. That's these number 35s. So number 35 is the sciatic. It comes actually out in between gluteus medius and piriformis. So remember, so go take a look at those leg models, pick the butt off, and you'll see the big, huge sciatic. The sciatic basically comes down and is part of the sacral plexus. The other big one is this one right here called posterior femoral cutaneous. I know it looks like it's going in towards the inside, but it's actually in the inside back part of your leg. So if you actually rub in the back inner part, that's posterior femoral cutaneous. And then the sciatic goes behind the back of the femur. So the femoral's in the front of the femur, the sciatic is in the back of the femur. There's actually two big branches. It runs down the femur, and when it gets to the knee, it branches into two big branches. One is going to come off and go around the side of the leg and go down the fibula. As it comes off, it's called the common peroneal, and it splits in the front to become superficial and deep. So I think you see this one right here, this 34 right here? Or is that 37? That's a 37. See this 37? 35 here. See this 37? It's coming back out and is going around the knee. That right there is your common peroneal. When it comes around the front, like here it is coming around the front again. So picture this nerve coming around the back of the femur, coming out, there it is. It splits into superficial and deep. What's left after common peroneal is the tibial. Tibial goes basically back down the back of the leg. And this nerve right here is the sural. It actually goes through the calf, the meat of the calf. So you can see here one of these nerves called the lateral sural. I just call it the sural. I think that's what this is, because that goes through the meat of the gastrocnemius. So the one thing that bothers me about this, this is saphenous. These are little branches of the knee. I don't think you have to know them. Again, all these little branches. This is, again, posterior femoral cutaneous. Have no idea what 43 is. None whatsoever. I have no idea. I mean, they do this all the time. They put numbers next to the stupidest things. So that is the nerve board. I think that's most of the major nerves you need to know. Yeah, their plexuses are bad. Cervical, brachial, lumbar, and sacral. This femoral nerve is supposed to be coming off basically up a little higher. Okay? All right. Okay.